everyone. So this morning we're going to perform surgical wound dressing. The first thing that we're going to do is to check for the doctor's order. Okay? We need to check if there is a prescription or order from the doctor to clean the wound of our patient. So I'll check the doctor's order, and there is an order to change the dressing. Aside from the doctor's order, we need to check for the nurse's documentation. We want to know if the previous nurse performed dressing or not. So I checked the nurse's documentation, and it appears that the dressing was not performed previously. So at this point, I'm going to go to my patient and perform some assessment before the procedure. Okay? We need to provide privacy, hand hygiene, okay, and introduce yourself. So, good morning, sir. How are you? I am Sir Leo Labrage. I will be your nurse for today. And I'm going to perform wound dressing because you had the surgery 2 days ago. But before I do that, can you state your full name? Can I check your ID band? Okay. So, this is Muhammad Ali 12345. Muhammad Ali 12345. So, this is my right patient. Okay, sir, before we start dressing of your wound, I need to perform certain assessment, and I will be having some few questions for you. Okay? First, sir, do you have any allergies to cleaning agent? Okay? The next assessment would be the site itself. Sir, can I check your wound? Can I see the location and the size of the wound if it is okay? So I'm going to expose the patient's wound. I'm going to check the location of the wound, so it's in the abdomen. I'm going to assess or check for the size of the wound. It seems that the wound is very small. I'm going to assess further. Check if there is bleeding. If the dressing is soaked with blood, check if the surrounding tissues are inflamed or swelling. Okay? And then you can close it back. Aside from that, you need to assess also for signs and symptoms of local and systemic infection. For systemic infection, you can ask or you can check the patient's temperature. And aside from that, one important assessment is to assess if the patient is having pain. Sir, do you have pain? And you need to ask also if the patient received pain medication. Okay? I'll try to check the patient received pain medication 1 hour ago. Why do we need to check for pain medication and pain of the patient? Because this procedure might cause some pain or discomfort to your patient. Okay? So, sir, give me a few minutes. I'm going to prepare the materials and I will be back. So at this point, we're going to prepare the materials that we're going to use. You would see that we have a trolley. This one, the metal table. We call this one a trolley. And it is where we're going to prepare our materials. And we also have wipes. These wipes is used to disinfect the trolley that we're going to use. We also have Inco pad or Inco sheet. We need to have adhesive remover. We're going to use this one to remove the old dressing of our patient. And of course, we need a pair of sterile gauze or 4x4 gauze. Clean gloves. Since this procedure is a sterile procedure and there is a risk for infection to the patient, we're going to use surgical gloves. What else? This is very important. This is the cleaning agent that we're going to use, normal saline solution. However, in some hospitals, they might have a different cleaning solution. This one will be used to cover the wound. We call this one as Mipur or dressing or wound dressing. And most importantly, we should have the dressing pack or dressing set. Okay? These are the materials that we're going to use. And of course, you need to check if these materials are not expired. So how they're going to start now? Before you go back to the patient, the next thing that you're going to do is to clean your trolley. Why do we need to clean this trolley? Because this trolley might have been used to other patient. It might have some microorganisms there, and before we bring it to the patient, we need to disinfect this one first. Okay, so you get some wipes, okay, and start cleaning the trolley starting from the top, starting from the center in circular motion like this. Okay, going to the side, going to the side. Okay, if you think that this is contaminated already, you can dispose this one and pick another wipes. Okay, and of course you need to clean also this side, one direction down. Use the other side again, from the top down, one direction. Use the other side from the top and on this side as well. Okay, and finally, the bottom part, you need to disinfect as well, starting from the center in circular motion. So our trolley now is disinfected. So at this point, we're going back to our patient and we should bring all these materials that we have prepared. Again, provide privacy, introduce yourself, hand hygiene, and identify the patient. So at this point, we're going to prepare the patient and we're going to adjust the height of the bed. Of course, it should be within our working level. I think this bed is very high for me, so I'm going to put it a little lower. Okay? Or if you think that this position is comfortable for the patient, it's fine. Or if you want to put the patient in supine position, it's fine also. Okay? So at this point, we can start the procedure with our patient. And the first thing that we're going to do is to remove the old dressing from our patient. Okay? So, put on your clean gloves. Okay. And, sir, I'm going to start the dressing procedure. Can I expose your abdomen? Okay. I will expose the wound, but make sure that the rest of the patient body is covered. Expose only the wound area. And we have here the Inco sheet or Inco pad. This will prevent soiling of the bed. You should put it here. Okay. Sorry. Okay. So at this point, the old dressing is exposed. So what I'm going to do now is to remove this old dressing with the use of adhesive remover. Okay, this is adhesive remover. Okay. I want you to observe the proper way of removing the dressing. So this old dressing, it sticks well into the skin, and you cannot remove this one without using adhesive remover because it's very, very painful to your patient. So with the use of your adhesive remover, apply it onto the sides of the dressing. Okay. This will soften the side, so it would be very easy for us to remove the dressing. Okay. Okay, so at this point, all the sides are wet and we are now ready to remove it. How do we remove the old dressing? With the use of your finger, okay, start from the corner of the dressing and you have to support the skin by pushing it down like this, see? Remove the dressing towards the center of the wound. Okay, very careful because it is very painful. Again, shuaya towards the center of the wound. Okay, all sides. One finger will support the skin while the other finger is removing the dressing. Okay, sir, I'm going to remove the dressing. Careful. Go to the other side. Loosen the side. Okay, now, all sides are loosened. So I'm going to take with my gloved hand the old dressing that we have. In doing this procedure, use your palm and make sure that the patient cannot see the dressing itself, away from the patient's face, and try to assess the gauze. Okay? Try to assess for the odor, try to assess for the drainage, okay? And try to assess also if it is saturated with blood and so on. And after that, with the use of your gloved hand, dispose this one together with the gloves. Now, at this point, you proceed with the assessment of the wound. Okay? Again, observe the surrounding tissue of the wound. There's no inflammation. Okay? What else? Try to observe for any presence of drainage. Try to assess if there are active bleeding. Try to check the appearance of the wound. Try to check if the wound is approximated or the wound is close together. Okay? Those are the things that we're going to assess. After you do your assessment, you get your gauze and cover the wound. Okay? At this point, the wound is covered. We can now proceed to preparation of our materials. So remove your old gloves. Do your hand hygiene. And we can now start setting up the table that we have for our patient. Okay, so here's the trolley that we're going to use. Okay, so the first thing that we're going to do is to set up this dressing pack. Okay, and you can observe there is a flap here. That means it is where we're going to open with the use of our finger. Like this, without touching the inside part. Okay, drop the content of the dressing pack into the table. Now, how are you going to open this one? Observe that there's a flap here. Here, see? Loosen the flap away from you without touching the inside part. Again, there's a flap on the other side. Pick this one, open. And there's another flap here. Open it to that side. And finally, there is a flap here. Open it towards your side. So we are now uncover the content of our dressing pack. Remember, this material is sterile and I am on my bare hands, so that means I cannot touch this one with my bare hands. Okay? So now I'm going to set up this one. How I'm going to start? I need to pick this, the yellow container, because it is where we're going to discard our used materials. How I'm going to do that? By touching the bottom part of this set. Okay? Try to reach or try to remove this yellow plastic, because this is where we're going to dispose our used materials. Okay? And we're going to attach this one in this side. Like this. And make sure that the opening is widely exposed. Okay. What else? Now I'm going to prepare the wound dress. Okay? This is a sterile package, so that means I cannot touch the inside part. So what I'm going to do, put the content there, locate the flap, open it with your thumb, and see you will see the dressing, but you're not supposed to touch it. Instead, turn it upside down and drop it into the center. Okay. What else is missing? Okay. At this point, we're going to put the cleaning agent to our table. We have the normal saline here. Okay? Open the normal saline. Okay? Discard the first drop and pour it into our set. And doing so, make sure to maintain a higher distance in order not to touch our table. Okay? Make sure that the cotton or the gauze that we are using will be soaked with normal saline. And then we can dispose this one. Okay? So our table is ready. So at this point, I'm going to prepare the gloves here. This is the sterile gloves that we have. I'm going to open the package. Again, using the flap. Open it like that. Okay? And the gloves is exposed. So at this point, before we start the procedure, I need to perform surgical hand washing, which I'm going to show you on a separate video. Okay? I'm going to have a separate video on surgical hand washing. So assuming that I'm done with my surgical hand washing, I'll go back to my patient. Okay? And start performing surgical glovings. Without touching the table, open the package. Okay? And you will see there would be two. Okay? There is a right gloves and there is a left gloves. It is properly labeled so that you will not be confused. Okay, how do you start glovings? Start with your non-dominant hand. Or you can start with your dominant hand, it's fine. So I'm going to start with this one. How do I start glovings? This one. First, grasp the cuff. This is the cuff. The outside part of the gloves is sterile. So that means we're not going to touch them. Okay. Pick the cuff. Insert your right hand. Like this. And release. Now, how do you gloves your left hand? Since you are wearing your gloves already, that means you are sterile. You can now touch the outside part of these gloves. Okay? Try to insert your hand under the cuff like this. Okay? And then your thumb should point away. Insert your left hand like this. Okay? And now, you are wearing a surgical gloves. Since I'm wearing surgical gloves, I can now touch the table with my gloved hand. Okay? Like this. Okay? And now, the first thing that I'm going to do is to arrange the table. And you will see that we have a couple of supplies here. We have the 4x4 gauze to dry the wound. We also have forceps. We call this one as forceps. We have the blue forceps and we have the green forceps. We need to decide which color of the forceps we're going to use to the patient and which color of the forceps we're going to use with our table. Okay? We do not mix those forceps or else we're going to cause infection to our patient. And of course, you can see also this gauze with cleaning agent that we have poured earlier. Okay? There's also a measurement instrument here. Normally, we use this one to measure the size of the wound. And of course, we have the dressing here. Now, how do we start the procedure? With the use of your forceps, like this one, okay, try to pick the gauze that we have covered the wound earlier, okay, and drop it into the yellow plastic together with the forceps, okay. So at this point, I can now start cleaning the wound. So how do I do that? Of course, you need also to squeeze off excess normal saline or cleaning agent here. Squeeze off. Maybe it has a lot of cleaning agent or cleaning solution. I will remove excess cleaning solution in here by squeezing the gauze. Okay, now, I decided to use blue forceps for my patient, and I'm going to use green forceps for my table. Okay, I will not mix it up or else I'm going to cause infection to our patient. Observe also the position of the forceps. This should not be held like this, or else you're going to contaminate your entire forceps. It should always be like this. Okay, so how do I start? Pick one gauze here and try to pass it to your blue forceps without touching each other. Like that. And now you can start cleaning the wound. So how do you start cleaning the wound? Start from the farthest, okay? In one direction only, okay? So start from the farthest in one direction, start from the center. In one direction, one, okay? And then I need to drop this one. I need to get another one, pass it to the blue forceps, and clean the wound. Observe that I'm using one gauze in every stroke. Why? Because, we do not want to clean the wound forward and backward with the use of the same swab or the same cotton, because you're going to cause infection to our patient. So we're done with the center. I'm going to the other side. Again, one direction. And then drop. Get another cotton. Pass it to the blue forceps. Go to the other side this time. One direction. Okay, drop. Get another cotton. Okay, one direction. Okay, so at this point, we have already cleaned the wound, so we can dispose this one. So at this point, we're going to dry the wound. We have a gauze here. And we need to fold this gauze like sambusa. Okay? And then start drying the wound. In drying the wound, you do not dry the center of the wound. Why? Because the moisture of the disinfectant, the cleaning agent, will promote wound healing. So instead, we're just going to dry the side. In one direction also. Okay? Drop this one. Pick another one. Okay? Now I'm going to dry the other side. And now I can drop this one. Okay, so the wound is dry already. At this point, I'm going to cover it with our wound dress. Okay? You just need to open the side like this and put it snugly over the wound. And make sure that the side attaches well to the skin of our patient. And at this point, you can still get some gauze here. If there are some, cleaning agent, or there are some wounds on the surrounding tissue, you can clean it with your excess gauze. So at this point, we're done with the dressing of our patient. You will see, I'm now going to cover again the patient with the patient's gown. Okay, I will remove this one. And make sure to discard used materials properly in here. Okay? Tie it like this and dispose it to the bin. And of course, you never leave your patient unattended. Okay? Remove your gloves. And make sure that your patient is well covered. And make sure that your patient is placed comfortably on bed. So we're done, sir, with the dressing. How are you? So we'll return back all the materials that we have used. Again, we disinfect this table with the wipes if necessary. And of course, after the procedure, after a few minutes, you go back to your patient and do evaluation. So what are you going to evaluate at this point? First, you can ask if the patient experienced pain. Okay, sir, do you have any pain? Aside from that, you need to assess also for the dressing itself. Sir, can I check the wound again? Okay. Try to expose the wound and check if there is an active bleeding. Okay. Or if the patient has some other discomforts. Okay, sir, thank you so much. You can have your rest now. And after the procedure, the last but not the least is, of course, you need to document your procedure. Okay? You start with P, problem. Okay? And you need to include in the problem what are the assessments that you have found. And then your intervention would be the procedure that you have performed. The wound was dressed or the wound was cleaned with cleaning agent. And the last but not the least is evaluation. What did we evaluate? We asked if the patient has pain and we check if the dressing is soaked with blood or anything. And that is our procedure for today. Thank you so much.